It's October, so it's Dysautonomia Awareness Month, and I want to talk about reimagining POTS rehab from a functional neurology paradigm. POTS, or postural orthostatic tachycardia syndrome, is a disorder of the autonomic nervous system where the balance between the sympathetic and parasympathetic systems has been dysregulated, and this dysregulation can cause quite a variety of symptoms ranging from rapid heart rates, feelings of anxiety and panic disorder, but it could also come with other disorders like migraine headaches. It could come with frequent aspects of brain fog, exercise intolerance, light sensitivity, difficulty with bowel and bladder control. So the list is pretty extensive on how this autonomic disorder can impact a patient's life. POTS can come in different forms and has different causes ranging from concussion to an autoimmune disease. But at a fundamental level, the thing that POTS tends to have in common is that when postural changes occur or changes in the demands of the brain occur, there's a compensatory rapid heart rate that occurs, and there's a resulting failure of efficient oxygenation and blood flow getting into the brain. When blood flow is not getting into the brain efficiently, there's less oxygenation of all those brain tissues. And when there's less oxygenation of those tissues, then something called a metabolic mismatch can occur, meaning that the demands of energy for the neuronal activity are not being met by the blood flow and oxygenation that is being delivered by the heart and the cardiovascular system. This metabolic mismatch can leave people feeling pretty tired and exhausted, but it also puts the brain in a state of stress, and that state of stress can exacerbate the cycle of sympathetic nervous system dominance, leading to more sweating of the hands, increased fatigue, shortness of breath, and just a general feeling of feeling unwell. For years, people have tried to get patients with autonomic disorders to exercise to try to treat their condition. The problem is many patients with POTS have exercise intolerance, and this is most clearly seen in those who have things like chronic fatigue syndrome, in which patients who are told to exercise develop post-exertional malaise. And this post-exertional malaise means that when you challenge the patient to exercise more, their condition actually deteriorates quite rapidly and ultimately makes the person's life worse. This is where functional neurology has really become pretty innovative in developing treatment protocols that help a patient with POTS get to a next step in their rehabilitation process. Now, I'll give you a fair warning. There's very little evidence that anything that I'm saying is supported by anything in the peer-reviewed literature. All I could tell you are things that we've seen from our clinical experience and some hypotheses about why this may work. Someone with severe POTS has metabolic fragility, meaning that they have very low tolerance for things even as simple as walking, then we may have to dial back what we consider exercise to things that are very easy for a patient to try to accomplish. This might mean we might look at things like passive movements of body parts, where we move the legs for the person. We might change the position in which they do exercise, so that instead of sitting up and fighting gravity, maybe we could have them lay down and have them do some bridges with their hips so that there's not as much cardiovascular demand in order to get their blood to go up into their head. It might mean that we have to monitor the patient of doing their exercises. We'll use a device like a pulse ox, where we can measure changes in the person's heart rate, their perfusion index, and their O2 saturation, and we dial back the exercise if we see that there are abrupt changes in some of those markers. Maybe it means that we use eye-head vestibular exercises where we have them track targets using their eyes, so they're not using the big metabolic demanding muscles like their leg muscles and their cardiovascular system, and we could just have them move their eyes back and forth, doing things that are much less demanding for the brain and the central nervous system. Most importantly, we keep those exercises to a patient's tolerance, meaning that as soon as we see that they're showing signs that their nervous system is getting fatigued, meaning that their eyes may start to dilate extra, their hands might start to get a little bit clammy and sweaty and cold, they might notice that their heart rate is starting to spike, then we immediately start to reduce the strain on their nervous system and let them relax. And this process of challenging the nervous system and letting it relax ultimately may be the thing that can help a person build up increased metabolic capacity to do more exercises in the future. So like I said before, we don't have any clinical trials or even large observational trials that this works, but this is one of the things from our clinical experience when we've seen POTS patients for 10 years or so, that if we could gradually increase the amount of work that the POTS patient's brain can tolerate over time, then just like many people, their range for capacity for sensory stimulation and exertion starts to increase with that. Or we've had POTS patients who were coming in with wheelchairs are now able to do things like participate in the CrossFit workout. Or we have POTS patients that couldn't imagine exercising beforehand are actually being able to go for 2 to 3 mile walks in order to improve their cardiovascular fitness, even though that they have POTS still, that their symptoms are under much better control because they've done the work from a very small level to gradually and incrementally improving their capacity over the course of months and sometimes years.